Hello everyone. Today in series of Doc Plexus interviews, we have with us Dr. Geetha Mary Philips. Welcome ma'am, who is the renowned lead senior consultant in the Department of Internal Medicine in Aster Academy in Ernakulam and Training Program Director, Core Medical Training, UK. She held the position of President and Secretary in Association of Physicians of India, Kochi. Thank you for having an interview with us ma'am. So today the topic of discussion will be fever of unknown origin. So ma'am, I wanted to ask, fever of unknown origin itself sounds curious and thought provoking. Can you please elaborate on this?
Yeah, that's a very interesting topic, because when we say fever of unknown origin, it means we don't know where the fever came. And many patients come to us with fever of 3 weeks duration, 4 weeks duration. They have gone to various doctors, they have done many tests, and they don't know the cause. So that is fever of unknown origin. It's also called pyrexia of unknown origin. That means we have investigated the patient completely, we have done all the obligatory investigations, we have done CT scans, we have done all chest x-rays, but we have not found the reason. So it is a very challenging treatment that requires. We have to first find the reason. Only if we find the reason will we be able to treat the patient.
Ma'am, I wanted to know what are the etiologies associated with fever of unknown origin?
Yeah, we always tell our students there are only 3 or 4 etiologies, 3 or 4 common findings. One can be an infection, so it could be a rare infection, rare bacterial infection, rare viral infection, or a common bacterial or viral infection, or even a fungal infection which can masquerade. You can't find it. That could be one. Then some of the malignancies, they can present as pyrexia of unknown. You have fever, you can't pick up, but later it turns out to be a malignancy. Then one large group we have is the autoimmune diseases. Autoimmune diseases will appear like pyrexia of unknown origin. The patient has high grade fever or low grade fever, more than 3 weeks duration. You haven't found out the cause. So that is a pyrexia. So you have infections which can be rare or common infections masquerading as atypical presentations. You can have malignancies, you can have autoimmune diseases, vasculitis, and sometimes we never find out the reason of the fever.
Okay. So Dr. Geetha, can you brief us about its management?
Yeah, it is a very, very challenging problem for a physician. So what happens is patients go to multiple hospitals. It starts off as a fever of 1 or 2 days, then it doesn't subside, it goes on 1 week, 2 weeks. So 1 hospital, 2 hospitals, they have done all the necessary testing. There is nothing positive in it. So the patient lands up in a higher center. So that itself is a big challenge. You have to find out what is the disease, and the patients are very impatient. Now in Kerala, patients are very well educated and they are in a hurry. Even though they have visited multiple hospitals and they come to you, they are in a great hurry. So the first thing we tell them is, this is like the chicken searching for its food. You have to dig, you look here, you look there, but you'll find the cause, because ultimately the disease will reveal itself. So it's not because one physician is smarter than the other, but it's just because the disease will come out, it reveals. So at that time a diagnosis can be, and no treatment can take place unless you have a proper diagnosis.
Okay. So we always say that prevention is better than cure. Are there any preventive measures to be taken into considerations, especially for children?
Yeah. Now in pyrexia of unknown origin, when I said infection, some of the rare infections are picked up during travel. People from India or Kerala or wherever, they go abroad. They go to mountainous areas, they come into contact with animals, they are involved in some occupations for which they can get diseases from animals. So these things can be prevented. There are a lot of people who are pet lovers, but I personally feel you should keep a distance. We had this boy who had a pet as which was a monkey. and he had fever for about 3 months. We couldn't pick up. There was nothing positive. Several blood cultures were negative, but in the end, after a long time, we found out it was a disease called brucellosis, which he picked up from an animal. So these things, close contact with animals, your occupation, your travel history. Now, when you travel to endemic areas, if you're going to an area with malaria, you could take a prophylaxis. Typhoid areas, you could take a vaccine. So these things would be important.
Okay. So in your opinion, ma'am, what is the prevalence of such kind of fever in India? And are we under major threat?
No, we are not under major threat. The prevalence is very low, because I would always like to say that the fever, two things will happen to a fever. Either it will subside on its own, or within 1 week we get the diagnosis. It's only a very minority which will go on for more than 3 weeks, which will go on for more than 3 weeks and you haven't found the cause. So that is a low number. But even though it is a low number, there is a high morbidity and mortality. The patient is sick, cannot go to work, nobody has found out the cause of the fever. It can even result in death if we haven't found out and treated it. So the problem is not such a high rate, but it is there and we have to be aware, because many people are coming under the threat.
Okay. Thank you so much, ma'am, for this session. And it was a great interview with you on this very interesting topic of fever of unknown origin.
Thank you very much.
Thank you, ma'am.